So when assessing which ribs to treat for functional balancing or for a rib correction, we're going to look at a couple of sets of bony landmarks. First would be the costal tubercles, these little bumps which are right next to the transverse processes. The next landmark would be the costal angles, these little angles where the rib makes its bend to go forward. Depending on the size or the girth of your client, with a soft C as you run down the back, you'll be able to get a sense. First of all, we're looking for a straight line. The costal tubercles should make a straight line that gets slowly wider away from the midline as it goes down. Same thing with the costal angles. So if I'm feeling and I notice one feels pulled more medially, closer to the midline, out of that line with the rest, I'm going to try to treat that one. The other quality that we're looking for is a sense of homogeneous tension and mobility amongst the ribs. Right versus left. Does this rib move easier? Does it have more tension holding it? So besides having a bony landmark out of line, look for a rib which is being held with more tension and treat those. So the shortcut technique to releasing these ribs and sharing some slack with all of the different parts of the body that the ribs hang on to is by going straight to breath. So the first thing that I'm going to do is I'm going to warm up my client's shoulder girdles and back muscles, taking care of the outer layers so we can get some access to the deeper layers. And let this shoulder blade be heavy in my hand. So first I'm going to ask her shoulder girdles to release. As you exhale, let this armpit, let this shoulder blade float tall and wide out of your left leg. There we go. So when you feel a release of the shoulder girdle, that means that these surface layers are going to be softer. They're going to let us be able to palpate the costal angle of the ribs. So my fingers are going to search down Rachel's ribs, and I feel right here there's a rib that's sticking up at me. It's not in a straight line. It's pulled a little bit tighter into its joint with the vertebrae. So I feel that bump, and when you feel those bumps, the ones that are out of line with the rest, you can check in with your client. What does that spot feel like? Tender. It's a tender spot, more tender than the other ones around it? Mm-hmm. Okay. So now this is where we are going to remember that that rib hangs on to an arm, a shoulder, a spine, a pelvis, a neck, a head. We're going to go straight to the breath to create this release. So this is the angle of your rib. I described to my client the pathway and help them feel the bone. It goes a little bit lower as it circles through your armpit before rising up to about this level to meet your breastbone in front. If you think about it, the rib is the shape of a horseshoe that's on the side of your body over here. I'm going to be putting some pressure in along that whole horseshoe and that bone, helping it push into the vertebrae it articulates with. And you're going to use the air pressure or the pneumatic pressure of your inhale to expand this rib backwards and sideways into the pressure of my hand. As you exhale, let it relax. And go ahead, big deep breath. Really get that moving backwards and sideways. And now, let it relax. And so after describing that horseshoe to Rachel and impacting it into its joint with the vertebrae. Again, it's being pulled out of line by excess tension between the vertebrae and the rib. So all these little muscles in here are a little bit freaking out and pulling the rib in. So I'm taking their job away by doing that holding for them. Then I take my other thumb and I place it on the opposite lamina, the opposite transverse process of the vertebrae. While you're breathing, big deep breath. I'll wiggle the vertebrae to provide some extra proprioception and help her nervous system find this joint. And as she reaches the kind of bottom of her exhale, you'll feel the rib just kind of melt. It gets to sink in towards that vertebrae and towards the costal vertebral joint. And then as you release, it just floats right back out. And you can check down the line again. Does that feel different?
Yes.
It's all worse?
No.
What's it feel like?
It's not as tender.
Excellent. Thanks for listening. Like Transcend Bodywork on Facebook, subscribe to our YouTube channel, and stay tuned.